We are live. We are live. I'm Dr. Frita, and it is Medical Monday. That's right. You're about to get all of the hot health topics in the headlines. And boy, do we have a lot. First off, I'll give you some updates of some health that made the headlines. We talked about Gene Hackman last week, but now we have a cause of his passing away, his wife's passing away, and his German Shepherd passing away, all three being found unalive on the same day. I'll give you that update. And then we'll talk about some very sad news as well. Tony, one of the founding members, Dwayne Wiggins, has passed away at the age of 64. I'll talk to you about the cause of his passing away and some ways to have it diagnosed and treated. And then we'll play my favorite little game, myth versus fact, because guess what? March is Kidney Disease Awareness Month. And my question is this: are your kidneys sending you SOS signals that you're missing? Well, we'll play the myth versus fact game where I'll give you some very important evidence-based information about kidney disease because, of course, I'm a board-certified kidney doctor. And then we'll move into the weekly dose where I'll give you a fresh take that you can't get anywhere else on these hot health topics. We'll start out talking about the measles. Boo. How infectious are the measles? We'll talk about it, and we'll talk about the benefits and the risks of vaccines. You don't want to miss that. And then we'll talk about braids. How many of y'all like braids? Well, are your braids making you sick? Yeah, we have some new information that some braids have some cancer-causing agents in them. So what are you to do? Are you to give up your braiding styles? Don't worry, we'll discuss it. And then we'll talk about Harrison Ford. Do y'all like Harrison Ford? Well, he had a recent diagnosis of the shingles. Can that happen to you? We'll talk about it. And then I'll give you a 5-minute quick health minute checkup. Okay, a 5-minute health checkup. And I'll run through some of the common things that you don't want to miss in the news. Like, are there recalls? Some different, new research that's going on. I'll just give you a quick 5-minute update. And as always, we are live. And so you can have a live interaction with me. We'll have a little piece of live Q&A. But if you want the real long Q&A, join our membership for the monthly Q&A. Listen, y'all don't want to miss this. We're about to have a great show. I'm Dr. Frita. This is Medical Monday. Let's get it going. Hello. We're live. I'm Dr. Frita, and let's just jump right into these hot health topics in the news for Medical Monday. Y'all know I don't do it alone. My co-host and my practice manager, Miss Shador, come on to the stage, please. Hey Shador. How are you doing?
Doing pretty good. How are you?
Good. You had a good weekend, I hope?
I did. For some reason, I'm the go-to for birthday parties. The one my little cousin, she's finally turned 2. Ever in a decade. So yeah, I had a pretty good weekend.
Baseball. Very good.
So how was your weekend?
It was good. It was somewhat laid back. My nephew came to hang out with us, and my kids for AAU basketball had a media day, so that was fun. But then we cooked, we laughed, we talked. Yeah, it was just pretty great. And of course, I watched the Real Housewives of Atlanta premiere. Y'all don't even pretend. Y'all know I'm an RHOA fan. At any rate, I'll tell you what I'm not a fan of, Shador. I'm not a fan of some of the depressing news that we've been getting, but on this channel, we take headlines, even when they're sad, and we turn them around and we try to use them as tools for us to live our healthiest, happiest lives. And so some update, Shador, is that we had some new information. One, we now know the cause of the passing away of Gene Hackman, his wife, and his German Shepherd. And we had some more sad information. But first, Shador, who was the first one in the chat today?
First in the chat today was Purple Onion.
Purple Onion. Love me a purple onion. Onions are wonderful. They have quercetin, antioxidants. They're great for blood pressure. And Purple Onion, I love you for joining. Thank you for being first in the chat. All right. So let's start off talking about Gene Hackman. We know the Oscar award-winning, Academy Award-winning Gene Hackman was Lex Luthor in Superman. That was my favorite movie. And we know that he passed away recently at the age of 95. But we know that he was found along with his wife, who was also not alive, as well as his German Shepherd. The dog was gone too. And it was really mysterious. People were wondering, is it foul play? Was there some case of someone taking one person's life and then taking their own life? We didn't know. But now, the autopsies are back and we know. And listen, this is kind of wild. His wife, who was only 64 years old, they believe that she passed away first with hantavirus. Okay, hantavirus. And if y'all have questions, if we have time, we'll get into it more later. But we know that hantavirus is a virus that's found in rodents. Okay, like rats and mice. And if you are around an infected mouse's feces or urine, then you can get hantavirus. And the hantavirus can cause a few things. It can cause pulmonary syndrome. And here in the United States, that's the one that's more common, where you can have severe respiratory failure. It'll start off as having flu-like symptoms, and then it can move to respiratory failure, and you can pass away. In fact, 38% of the people who get this pulmonary syndrome from hantavirus, 38% can pass away. Okay, so it's pretty serious. And there are other forms that are less common in the United States of the hantavirus that can actually cause a hemorrhagic fever, like where you're bleeding and having high fever, and you can even get kidney failure. But his 64-year-old wife had hantavirus, and she passed away. And they believe that about a week later, he passed away. Okay. And so his wife is sitting there and she's not alive, and he's walking around, yet he didn't call 911. Well, something else we learned is that Gene Hackman had severe dementia. He had a late stage dementia. And so the question is, did he even understand that his wife was not alive? And if he did he still have the cognitive ability to call 911? It was advanced. But what we do know is that about a week after she passed away, he passed away, and they're calling it an event. They believe it's cardiac, but they can't be sure because he had previous heart disease as well. So she passed away. A week later, he passed away. And so what about the dog, y'all? What about the German Shepherd? Well, the German Shepherd had a recent procedure and was crated. Okay, so the German Shepherd was put in the crate. And so the speculation is that the German Shepherd probably starved to death. Y'all, I can't stand this story. It's the saddest story. And then it makes you ask questions about isolation. Y'all drop down in the comments what you think about the passing of these 3 lives and what can be done to prevent things like this. You know, like how many of you, if you went a week, 2 weeks, 3 weeks without anyone hearing from you, how many of you can honestly say that no one would reach out, no one would miss you, not your job, not your cousin, not your mom? And if you are an isolated person like that, then perhaps it's time to think about having some type of a life link, right? But yeah, so sorry to hear, of course, about that tragedy. And this is really mysterious. And then hantavirus is something that's new for us talking about on this channel. All right. And then, y'all, Tony. If you like Tony, please put in the chat your favorite Tony song. Well, Dwayne Wiggins, one of the founding members of Tony, passed away on Friday at the age of 64. Yeah, he was the guitarist, and he was one of the founding members, a co-founder of Tony. And he did have bladder cancer. We know that he had bladder cancer. And if you go right here to this YouTube channel and you look at my YouTube shorts after you finish watching this live, I go into a pretty detailed delivery on one of the shorts on exactly what bladder cancer is and how it can be diagnosed, some of the risk factors and the treatment, things of that nature. And so once you finish this live with me, then please go ahead and check out that short. But certainly our prayers go up for the family and the loved ones of Dwayne Wiggins. Y'all, Tony, another soundtrack of my life. I think mine is Whatever You Want. That's my favorite song. But I also like Anniversary. When y'all hear that Anniversary hit, you know it's about to be something. Yeah, but I just wanted to give you those quick updates before we got started with our regularly scheduled programs. Anyone make any comments so far in the chat, Shador?
Yes. Aaron. Hi, Aaron.
Hey, Aaron.
You say it feels good. Yeah,
it feels good. Oh, get it, me. Yes, you're right. I love that song too. Oh, who else?
Veronica. Hi, Veronica. Her favorite song is It Never Rains in Southern California.
It never rains in California. Okay, y'all must stop.
Yes,
I love these songs. I mean, like they make me happy. You know what I mean? It's just amazing. All of us have different talents in our lives. Clearly, singing is not my ministry necessarily, but you know, with the talent that they had, just it doesn't matter. Years, decades. As soon as you hear those songs, it takes you back to where you were and it gives you a feel-good moment. And so I certainly appreciate Dwayne Wiggins for his contribution to our lives, to our happiness, to music. And he also did a lot even after being really in the main spotlight. Like I understand that he worked with her and with some other really up and coming and a really popular artists. So he was still pouring his gift into the next generation of music. All right, look, I got them scared to put their songs up because now they scared I'm gonna sing it into the mic, no less. Hello, everybody. Yeah. So rest in peace, Dwayne Wiggins. All right, y'all. Let's go ahead and get started with some more of these health topics that have made the headlines. And y'all know my favorite game, myth versus fact. Listen here, it's Kidney Disease Awareness Month. And for those of you who are new to the Dr. Frita channel in our YouTube Live, I am a board certified nephrologist, meaning I'm a board certified kidney doctor and high blood pressure doctor. I've also been board certified in internal medicine, pediatrics, and obesity medicine. So this is Kidney Disease Awareness Month. I'm also a board member on National Kidney Foundation. Oh my goodness, I'll be posting this just last week. I hope some of y'all got a chance to catch it because I did a panel with the National Kidney Foundation, Ask a Nephrologist, and it went really, really, really well. I'll be putting a link up for that. And also if you go to nkf.org, you might be able to find it there. Anyway, so yeah, it's Kidney Disease Awareness Month. And so my question is this. Are your kidneys sending you SOS signals that you could have kidney disease? That's going to be the theme of the month. How can you pick up kidney disease? All right. So let's get started, Shador, with this first myth versus fact statement.
If you have kidney disease symptoms, it's too late for treatment.
If you have kidney disease symptoms, it's too late for treatment. Y'all know I'm always talking about early detection. But is this a myth or a fact? If you have kidney disease symptoms, it's too late. Put an M1 if you think that this is a myth, it's not true. Put an F1 if you think, yeah, this is a fact. All right, myth versus fact statement number 2.
Working out too much can damage your kidneys.
Working out. Y'all know I'm always talking about working out. Oh my goodness. I had a good workout on Sunday. I did. All right. So, okay. Is that true? Can working out too much damage your kidneys? Put an M2 if that's a myth. Put an F2 if that's a fact. Working out too much, too strenuously, can it damage your kidneys? M2 if it's a myth, F2 if it's a fact. All right, pencils down. All right, Shador, what do we have for the first myth versus fact statement?
Yes, ma'am. So mostly myth with this one, Dr. Frita. Have Anton says a myth.
Okay, so Anton says that, so if you have symptoms of kidney disease, then it's too late to be treated. He says that's not true. It's not too late. All right, Anton.
Sherry agrees.
Hi, Sherry. Okay, you don't think it's true either. It's a myth. All right.
Queen Gina says a myth.
Hey, Queen Gina. Oh, and Regina actually means queen. You know, like Regina in Spanish. All right, Queen. Okay.
Miss Kim says it's a myth as well.
Hi, Miss Kim. Okay, y'all aren't buying this. Y'all like if y'all get symptoms, you're not sitting at home. You're running and trying to get treated. Okay.
And also Tamara. So strong
Hello.
myths across the board, Dr. Frita.
Good deal. No one thought it was a fact?
No.
Okay, I can't fool y'all anymore. Y'all getting too smart. Okay. So drum roll. Yes, it's a myth. By the time you have symptoms, no, it's not too late to be treated. Now, it's true that if you're able to pick up kidney disease early, the earlier you pick it up, then more quickly it can be treated, or the kidney disease can be slowed down as far as the progression. But yeah, if you get symptoms, you definitely want to talk to your doctor. Now, here's the thing. The best way to prevent kidney disease is to be getting your regular checkups by your primary care physician, because we know that oftentimes kidney disease is silent. And so when you go to your doctor and just get your routine health histories and physicals, they're actually screening you for kidney disease there. They are. When they ask you different questions about your urine, about swelling, and even when they test your urine and it seems just run of the mill, they're looking to see if you're leaking protein in your urine, if there are red blood cells in the urine. So just your regular doctor is always doing a screen. And with blood tests, the BUN, the creatinine, and the EGFR. Yeah, if y'all are sitting there looking at your labs and your My Chart, yes, that's a screening for kidney disease. But if you start to have some symptoms of kidney disease, it's not too late. I'm going to ask y'all to go ahead and put some symptoms of kidney disease in the chat, and then we'll move on to the next question and come back to it. All right, so y'all didn't fool y'all with that one. So yes, it's a myth. You know, it's not too late just because you have symptoms. All right. What's the second myth versus fact statement, and how did we do?
Working out too much can damage your kidneys. So we have a mixture on this one.
Ooh, I can't wait to see this. Working out too much can damage your kidneys. And y'all know I'm always telling y'all to work out. According to the American Heart Association, most people should be doing 150 minutes of moderate exercise per week. So that's about 30 minutes, 5 days a week of moderate exercise. Okay, who says that it is a myth? Who says that it's a fact that working out too much can damage your kidneys?
It's Radiant. Hello, Radiant.
I love that name. Hi, Radiant.
Radiant says it's a fact.
Oh, Radiant. Working out too much can hurt your kidneys. All right, Radiant. Let's see if you know what you're talking about here.
Lisa J agrees. That's a fact.
Lisa J, y'all just might not want to work out. Okay, Lisa J says it's a fact. Radiant says it's a fact. Okay.
And Aline agrees, also a fact.
You think that working out too much can damage your kidneys, but don't I always say work out, work out? Okay, all right.
Our myth takers here. Tijuana says a myth.
It's a myth. It sounds like some old junk. Like, how can working out possibly hurt your kidneys? Okay.
Chatting with Elise. Hey.
Hi, Chatting with Elise. It's a myth. Okay. You don't think working out too much can hurt your kidneys?
And Marina also thinks it's a myth as well.
See, this is my favorite part of the game. I love it when folks are split, because that means it's not common sense. It's not common knowledge. And so it's a teachable moment for everyone. All right. Working out too much can damage your kidneys. Drum roll. That's a fact. That's a fact. Okay, I know y'all are shocked because I'm always saying work out, work out, work out. But listen, if you do strenuous exercise that's actually more strenuous than what your body can bear, you can get a condition called rhabdomyolysis. Rhabdomyolysis. Put a 1 in the chat if you've heard of rhabdomyolysis before. So what happens with rhabdomyolysis is literally your muscles tear, okay, in the working out. Okay, so rhabdo, we're talking about skeletal muscle, and lysis, tearing. So you're working out, you're lifting weights, and even though it's really hurting and it's more reps than you've ever done, you're thinking no pain, no gain, no pain, no gain. And so you keep going, you keep going. Well, if this happens, then the next day you might have swollen muscles, right? And I don't mean just a little bit of soreness, but I mean where you almost like can't walk, can't bend your arm, and the muscles might be visibly swollen. And then you might feel very tired, quite fatigued. And when you urinate, you might actually have dark colored urine, like Coca-Cola colored urine. If this is the case, it's a great chance that you have rhabdomyolysis, and that means that your muscles have torn from too strenuous of a workout, and oftentimes dehydration as well. And when this happens, the pigment that is inside of your muscle cells called myoglobin. So when the muscles tear, that myoglobin, that pigment is released, and that pigment is poisonous. It's toxic to your kidneys. Okay. And so by working out too much, tearing up too many muscle cells, that can cause you to have literally kidney failure. And I have had to dialyze people from working out too much. Now, does this mean you need to go to your personal trainer and tell your personal trainer, hey, stop pushing me? No, not necessarily. But if you know good and well, especially if you're not hydrated well, and if you're pushing yourself to the limit where you are just in extreme pain, the reps are way more than what you're used to, and if you're having those symptoms that I described, then you want to make sure that you consult with your doctor, that you hydrate yourself. And here's something where it's really common, and Shador, you know, because we've seen patients in the office with this. It often happens in certain training, like military training, okay, where there's a lot of pressure of the no pain, no gain. I don't want to seem weak. I've seen it with firefighters, okay, young firefighter men. They're out there with these heavy uniforms, and so they're sweating, they're getting dehydrated, they're pushing themselves because they want to prove that they're strong enough. And the next morning, they might have swollen muscles, dark urine, severe fatigue, kidney failure. So I've seen it with firefighters. I've seen it with people in military training, people going for police training, football players. I've definitely seen it with people doing football training, these young guys, college, high school. Yes, I've had patients like this where they've got the football helmet, all the pads, they're running, again, proving themselves, overexerting themselves, and they get rhabdomyolysis. So yes, working out in too strenuous of a manner can lead to kidney failure, specifically rhabdomyolysis. So all of you sports moms who are out there telling your son, don't be last, keep running, don't stop doing push-ups. Okay, I've been guilty of that. Make sure your child, I know I'm just quoting myself, but make sure that your child is hydrated and that your child feels confident enough to go to you or go to the coach when they really, for real, feel like they've been pushed too far. All right. Yeah, that was a good one. Did anyone put a one in that they've heard of rhabdomyolysis? I don't think it's really common knowledge per se.
Yes. So Miss Paula.
Okay, you've heard of
Heard
it.
of it before.
Okay. Yeah. Yeah, but check it out. Look up rhabdomyolysis, like RHABDO myolysis.
Yeah, I
Yeah.
put it in the chat already.
Oh, you did? Okay, yeah. So if you have a child in sports, and especially if you're one of those crazy sports moms like me, where you be like, go, don't be late, push yourself, go, go, go. Just make sure you do understand that they could get kidney disease if they're not properly hydrated, if it's too hot, and if they are working out too hard. All right. All right. So for more information about kidney disease, you can go right here to where you are right now, the Dr. Frita YouTube channel, where I'm very proud to say, Shador, I think we have like over 839,000 subscribers. So thank you to everyone who subscribed. If you have not subscribed, please hit that subscribe button and go ahead and click the notification bell so you'll be among the first to know when we release new content. But on there's a playlist where I talk about kidney disease. And actually, if you go to the short, you'll be able to see where I talk about Dwayne Wiggins and I talk about bladder cancer. But also, I have another video. Now, for my members, listen, if you're members at one of those top tiers, then you'll be able to see this video on kidney disease that I have right now. If you're not a member, just hang out. I'm going to release it to everybody else tomorrow. But let's go ahead and just play a little preview of the video I have right here on this YouTube channel coming out.
All right.
Do you ever feel tired or have itchy skin or experience a weird taste in your mouth and you thought it was just stress or maybe age? Well, it actually might be your kidneys trying to tell you something. I'm Dr. Frita. I'm a board certified kidney doctor, and today I'm giving you 8 strange warning signs of kidney disease that might seem like something else. All right. So I actually had a lot of fun filming that video because so I go through the different warning symptoms of kidney disease, specifically ones that you might just kind of poo-poo away and think there's something else, but they could actually be a sign of kidney failure. And so again, for my members, you'll get a chance to watch it now. And if you want to be a member, it's not too late. Please just click the link in the description and join up one of our tiers. At the top tier is where you'll be able to participate in our members only monthly live Q&As. And I'm telling you, I sit there and all of the evidence-based knowledge that I have, I give it to you. Just brum. Okay, you can ask questions back and forth. You can even come up and be on stage. And then at the other tiers, you'll still be able to watch members only videos that I release. You'll get some first looks. So like in this case, we released, I think Friday, this video. Everyone else will get it tomorrow. But if you're a member, you've been able to watch the video for all through the weekend. And then we also have another tier, our least expensive tier in support that we definitely appreciate. You join that tier, you get custom emojis, loyalty badges, member shout outs, you name it. So come on and join the community. We're having a good time with these memberships. And so, click the link in the description and join us. All right. So now let's move into the weekly dose. Okay. The weekly dose of medicine. Here, I'll give you a fresh look at these health headlines that you won't get anywhere else. Let's start off talking about the measles. Okay, we've been talking about the measles because you know that we talked about the Texas outbreak and the child who unfortunately lost his life. It was the first loss of life from the measles that we've had in a decade. Okay, no one has passed away since 2015. And you recall that we actually thought that we had eradicated the measles back in 2000, but now with a lot of people having vaccine hesitancy, not getting vaccinated, and with a lot of there being misinformation, even at high levels, there's being misinformation passed. The vaccination rates are going down. And with that, we're seeing some outbreaks. We're seeing some outbreaks. So Shador, please go ahead and play this video and let's talk some about the measles.
Severity and in terms of infections throughout the entire United States. Measles is one of the most infective viruses known to man, and one person can infect 12 to 18 people. Contrast that, one person with the flu can infect up to 3 people. And so measles can infect almost 4 times as many people as the flu.
And now we're starting out this year with a bang, unfortunately. This is a pretty large size measles epidemic. Officially, the numbers are around 100 cases in West Texas into New Mexico.
And over 95% of those individuals are all unvaccinated for measles.
This virus is very hardy and can be in tiny droplets in the atmosphere. The measles virus can linger in the atmosphere, sometimes for a couple of hours or more, even after someone's left the room. So each place that individual went, you had to worry that he or she left a trail.
So we know that the measles, it's the most contagious virus that we know, actually. It's the most contagious virus that we know. And if you are unvaccinated and you come into contact with someone who has the measles, you have a 90% chance of getting the measles. And again, of the people who are getting measles infections, 95% of them are unvaccinated. Now, on the other hand, if you get 2 measles vaccines, then you have a 97% protection. And again, we thought we had eradicated it in the year 2000, but now we see that it's here. So here's my question for those of you who are in the chat. What do you think about the measles and the measles vaccine? Because you know that we have our head of HHS, RFK Jr., who has put out a lot of anti-vax information in the past. He was even over a documentary that was aimed toward the Black community where he was discouraging vaccines, specifically the measles, the MMR vaccine. And during his hearing, his Senate hearing, he stated some misinformation that there should perhaps be a different schedule for Black people when it came to vaccines. And he suggested that Dr. Gregory Poland's paper supported that. But the author of that paper came out and refuted RFK Jr.'s statement and said, yes, there are different antigenic responses to vaccines, but he said in no way does the science support having a decreased vaccine schedule. So I want to know in the chat, what do you guys think about the measles vaccine? I know that when I was in school, they were absolutely required, right? Unless you had some type of a medical issue. But now you can just say, hey, it's against my beliefs, and you don't get the vaccine, which would be one thing if getting the vaccine affected you and only you. But we know that people who aren't vaccinated, not only are they more likely to get the measles, but then you have people who are vulnerable, like people who are less than 1 year of age, which is younger than the recommended time to get the vaccine. They become vulnerable. And of course, immunocompromised people become vulnerable. So I want to know in the chat if y'all can put what you think about the measles vaccine. Meanwhile, I'm going to try to hop back on my computer in my routine audio. Y'all pray for the people. Let's see if this works.
All right. So I remember Miss Cynthia. She says, good morning, Dr. Frita. I'm an RN, MSN, but have gotten so much education from you.
Oh, wow.
And Lisa agrees. I believe MMR vaccine should be given.
Okay, but thank you, especially for the RN who said that she's learned a lot from me. And we're all learning, okay? Constantly reading, constantly learning. And the sign of an intelligent person and an excellent healthcare worker is one who's always continuing medical education. All right. So yeah, so I definitely believe that it should be something that unless you have some type of a medical, reason, it really should be more enforced in schools. Even with all these measles outbreaks, RFK Jr. is just kind of saying, it's just kind of up to the parents whether they get them or not, which, people have the right to ruin their own lives. But in this case, we know that the cases are growing and growing. And before we had the vaccine, we lost 400 to 500 people in the United States alone each year. Okay. And 500 years ago, when we think about all of these infectious diseases that are preventable with vaccines, 1 in 3 children passed away before the age of 5 due to preventable diseases, infectious diseases. Okay. And so we don't want to go backwards. We don't want to go there. Okay. And if y'all could also put in the chat, why do you think that so many people are hesitant now as opposed to, prior to the year 2000 or even prior to the year 2020? If y'all could put that in the chat. All right.
Ms. Kim shared, Dr. Frida's. I am a 70s baby. I thought measles vaccine was proven years ago.
It was. It really was. But here's what has happened since the 70s. There was a big push at one time where people were saying that the measles vaccine, the MMR vaccine, was associated with autism. Okay. That was a great belief. I know a lot of people who believe that, very intelligent people, well-read people. And this is why. So, let's talk about this. There was an article published in the Lancet journal, a very reputable medicine journal, in 1998. And in that study, there were 12 scientists, 12 physicians and or scientists who stated that there were 12 children who developed autism, and that 8 sets of parents felt that the autism was due to the MMR vaccine. And so there was a whole big write-up, and they said that the measles vaccine was associated with autism. So of course, so that was 1998. notice that's just a couple of years before we eradicated measles. And then, now we have more outbreaks. But then guess what happened? Very soon after that study was published, many other studies were done. So there were 12 kids in that study, but hundreds of thousands of kids have been studied since then with no correlation, with no cause and effect of the measles virus, the MMR, and autism. And so then we also found that the authors of that study, of the 12 authors, 10 of them withdrew their statements, okay, because there was a lot of faulty science and non-science done in that study. So 10 authors said, we're sorry, we withdraw this from the Lancet. One of the authors they did not get in contact with before it was withdrawn, but one of the authors said, no, I stand by my word, and I think that the MMR vaccine causes autism. Well, with him, they actually found him to be guilty of fraud, where he was actually manipulating data. Okay, they found that for a fact. And so the Lancet itself withdrew the paper as a non-factual paper with false information. So that was back in 1998. But amazingly, even though there have been numerous studies on several continents that have refuted that study, somehow that same study seems to be what people quote, people like RFK Jr., to give misinformation. So I know that's one reason.
Mm-hmm.
Yeah. All right. But definitely, consult with your physicians, educate yourselves. And right here on this channel, where I do give you evidence-based information, I have a video on the measles. Okay. So if you go to the YouTube search bar, Dr. Frita Measles, that one will come up. I also have a couple of videos on the truth about vaccines, where I go through in detail in a way that's easy to understand what goes on with vaccines, what goes on with your immune system. And I just kind of go into details on different vaccines, not just the measles. I'll talk about smallpox, polio, other ones as well.
Mm-hmm. While you're speaking of vaccines, Dr. Frita, I remember Miss Cynthia.
Hey, thank you for being a member, Miss Cynthia.
She says my 5-year-old nephew recently got chickenpox after receiving the vaccine.
Oh, wow. Now the chickenpox vaccine. Now I know the measles vaccine, getting 2 doses is 97% effective. Most kids who get the chickenpox vaccine will not get the chickenpox. And if they do, we believe that the case of chickenpox is actually less severe than what it would have been. So I'm sorry that happened to your nephew. That's a rarity. But I'm glad you brought up the chickenpox vaccine, because we're going to talk about that a little bit later. But yeah, but still, it is recommended that we get the chickenpox vaccine. Because I know if you look around, I know when I was growing up, everyone at some point that I knew had the chickenpox. But now half the kids don't even know what chickenpox are. And that's because the vaccine, by and large, is very, very effective. I mean, think about it. Other than your nephew, who's the last person you saw with chickenpox? I'm really sorry that happened to your nephew. He is definitely one of the rare cases. Yeah. All right. But you know what's not rare, Shador?
What's that, Dr. Frita?
Getting braids.
No, it's not.
Getting braids. I know I like to get myself some braids. Okay. 30-inch bust down braid do. My daughter likes to get braids. She's here visiting from FAMU, and she wants to get braids before she goes. She's going to have me pay for them. So, put a 3 in the chat if y'all get braids, or if y'all have loved ones who get braids. So no, this is not a beauty channel. This is still, Dr. Frita's YouTube Live, Medical Mondays. It's still about health, but this is what's going on. Some studies are now showing us that braiding hair can have cancer-causing agents in it, carcinogens, and other things that are unhealthy. Please play this clip, because this is a nightmare.
New this morning, it's used to create fashionable and protective hairstyles, mostly for Black men and women, synthetic braiding hair. But recent testing by Consumer Reports found the hair contains some potentially dangerous chemicals. In today's Insider, we break down the findings and explain how you can stay safe.
For many people, braided hairstyles are more than just fashion. They're a time-tested tradition that makes hair care easier.
I like to wear braids because it saves me time in the morning. They're convenient. You can just style it and just go.
Now, a new investigation by Consumer Reports is raising alarming questions about the safety of synthetic braiding hair. 10 popular synthetic braiding hair products were tested. The results are troubling. Every sample contained carcinogens, chemicals that may cause cancer.
3 of the samples tested positive for benzene, a carcinogen that is highly regulated and discouraged for use in laboratories because of the potential to cause cancer.
James Rogers, who led CR synthetic hair testing, says lead was found in 90% of the products.
There is no safe levels of lead. Our risk assessments and exposure models indicate that for users of these 9 products, they could be exposed to concerning levels of lead over time.
The risks don't stop there. When the hair is dipped in hot water during installation, as standard practice, it releases volatile organic compounds or VOCs that can irritate eyes, throat, and lungs. If you use synthetic braids or if you install them, experts recommend the following safety precautions to reduce risks. Check for product recalls, read labels carefully, and limit how long you wear the style.
Consumer Reports reached out to the companies who sell the synthetic hair that was tested. I posted their responses on clickorlando.com.
All right. So for anyone who responded, let me know for people who wear braids or know people who wear braids. And then I also want to know will hearing this report stop you from getting braids? Will it stop you from getting braids? I'm telling you, Shador, this is pretty scary because I know years ago, especially among Black women mainly, getting relaxers, the chemical in your hair to straighten your hair. And I know that non-Black women, white women, Jewish women, people with very tightly curled hair, other people use chemicals to relax their hair as well. But we know that by and large, it's people, Black women, 4C hair and so forth are the ones we've tended to get relaxers. I used to get perms or relaxers as we called them. And then we started hearing more and more information about how that chemical could be damaging to us. And it wasn't a big reach or jump because if you get a relaxer as a Black woman, those of you who have relaxers or have gotten them, if they stay on there too long, your hair is burning, your scalp is burning, that can't be good for you. And so a lot of us stopped getting relaxers. My children have never had relaxers. They've never had chemicals in their hair. Neither one of my daughters, certainly not my son. And I haven't had in, I guess, over a decade. So, okay, I've grown to live with that just fine. All right. But now about these braids, now that's a way to help to kind of hold on to your natural styles. It's easy. And so this is a big game changer for a lot of people if it's true. I mean, well, we do know that it's been found. We do know that these chemicals have been found in the braiding hair, but the question is that really going to increase our risk for cancer or for sickness? We know that benzenes can cause certain types of cancers. They can be associated with leukemias. We already know about lead. Lead can cause neurotoxicity, right? Neurological issues, the lead poisoning. And y'all know, for those of you who get braids, that at the end, when you have the synthetic hair, especially, your braider does what? She dips the braids in hot water. And now we know that releases VOCs, some of these volatile compounds. And so here is what I recommend. And they talked about it in the clip. One, when you're going to pick up your hair, research the brand to find if it's one of the ones that's been researched. Also do research. There are certain brands that pre-wash the synthetic hair. And you can also use human hair. Yes, that's much more expensive, but it's not as likely to have the cancer-causing agents. And if you buy the hair, you can even wash it yourself, the synthetic hair. But definitely it's worth a conversation. More research needs to be done, but there is no sense in getting cancer from braids. We don't know if it's actually caused cancer, but we do know that cancer causing agents have been found in the hair. What are folks saying in the chat, Shador? Are they done with braids?
Not entirely. So a lot of people use them or know people who use braids or synthetic hair. R. Barnes says, I have loved ones that get braids. I'm allergic to synthetic hair.
So that's one of the things. If you're like getting itching, burning with the synthetic hair, if you're getting a rash, then you might have been reacting to some of the chemicals in there, which could have been your body telling you something to help you. Okay, that's interesting.
Yeah, Lisa D says always. She always gets braids.
And that's something they're easy, right? And y'all know, like I think all through the summer, I wore my braids here. That's so easy. You just get up and go. You don't have to worry about it. My goodness. Yeah.
Yeah. Lisa J says, yes, this will deter her. I don't want cancer again.
Oh, now see. Yeah, I'm sorry that you've had cancer. And you have a point, because if you've had cancer before, then that alone could predispose you to getting it again. And so, yeah, I would be more careful as well. And certainly just something to think about, looking up brands that pre-wash the hair and actually doing the research on if the brand of hair you use was found in the study, and then also finding ways that you can wash the hair yourself. I know that a cousin of mine who does hair has always taken the synthetic hair, and she's put like vinegar, baking soda in there. Now, I don't have an official scientific study behind that, but I'm just telling you some ways, to research. Can you wash away some of the potential chemicals? That's really, yeah.
Somebody actually asked that question too, Dr. Frita. So thank you for answering, for saying that about can it be washed.
It can be washed. It can be
Mhm.
washed, but then the question is it going to have the same quality, or do you care? Is it worth risking it not looking the exact same? But I do know that there are companies that already pre-wash the hair. So that's something to research,
Yeah.
pre-wash synthetic hair. And again, to find out which brands were in the study and which brands actually were found to not have the same chemicals if they were in the study. Yeah. So just be careful. We don't want beauty to kill. But yeah, that one's a tough one. And it particularly hits the Black community, probably harder than any other community. All right. So now who was that? We talked about the chickenpox vaccine and the unfortunate young man who ended up with the chickenpox, even though he had the chickenpox vaccine. Well, let's talk about Harrison Ford, because he had something that is a sequela of the chickenpox virus, varicella zoster. He got herpes zoster, also known as shingles. Let's roll that clip, please, Shador.
Well, this just in, Harrison Ford will not present at the Oscars due to an illness. His publicist confirms the 82-year-old actor was diagnosed with shingles on Friday and canceled his planned appearance tonight. The Indiana Jones and Star Wars star was seen last week at the Screen Actors Guild Awards. Shortly after Ford's announcement, Mark Hamill was announced as a presenter in tonight's ceremony.
Hello, I'm Mark Brown. Get more.
Just like that, he had the shingles. Now, I want y'all to put a 4 in the chat if either you've had the shingles and y'all do not have to share your personal business, or if you know someone who's had the shingles, okay? I will tell you that from my patients, the shingles is no joke. So this is how it relates to the chickenpox vaccine that we were talking about earlier. The same virus that causes the chickenpox, okay, the varicella zoster, if you get the chickenpox, or even if you've had the chickenpox vaccine, that it can be reactivated into the shingles. So what are the shingles? They start off usually as some type of a burning sensation, maybe feel like a sunburn. And then afterwards you get a blister like rash, you get vesicles. But unlike the chickenpox, you don't get them all over your body, your face, your feet, your hands, everywhere, legs. No, it's on just one side of the body in one area or in a dermatome. So you might get them just on half of your chest or half of your back or half of the side of your stomach or even half of your buttocks. Or it's really serious if you just get them maybe on a little quarter or half of your face. Okay, and that's because they go in a specific dermatome, a specific place where there's nerve innervation. And when you get them, it's very, very painful. Okay, it might start off with the burning sensation, tingling sensation. And then once you break out with the rash, it's extremely painful and you're highly contagious. Now, you can't give shingles to someone else who has already had the chickenpox virus. In fact, you can't give shingles itself to anyone. But if you have shingles and you come into exposure with someone who's never had chickenpox and who's never been vaccinated for chickenpox, a person with shingles can give that person chickenpox, if that makes sense. It's the same virus. So in this case, unfortunately, Harrison Ford got the shingles, and you are, at risk if you are an older person, if you're an immunocompromised person, someone on chemotherapy, someone with HIV, where the HIV is not controlled to a point where it's a really low viral level and a high CD4 count level. If, things like that, if you're an immunocompromised person, older person, you're at higher risk for shingles. But we have shingles prevention. There is a shingles vaccine, yes. And it's recommended for people who are 50 and older. It's 2 doses. You get your first dose, and then anywhere from 2 months to 6 months later, you get your second dose. And it has a very high protection, like over 90% protection against you getting the shingles. So if you're over 50, please have a conversation with your doctor. Also, if you're someone who's immunocompromised, then have a conversation with your doctor. Do we have anyone who put any 4s or who's had the shingles, or if they know of people who've had the shingles?
Yes. TS. Hi, TS.
Hi, TS. Welcome.
TS. My son, when he was 24, got shingles. Very painful, large rash on his chest, high fever, meds helped some.
Yes. So 24 is pretty young. So normally we talk about immunocompromised people or older people, but I have had young patients as well. I know one of our young patients who was in his 30s when he got it. He's actually a kidney transplant patient. So him being on immunosuppressant transplant drugs would have predisposed him. But I also know of other people who have no known immunocompromises, no known diseases, who've been stressed out under high stress. And we know that high stress can affect your immune system, and they've gotten the shingles. Mm-hmm. So I hope your son is doing well. And for anyone who's listening, if just talk to your doctor to see if it's recommended for you to get the shingles vaccine, get the pros, get the cons, make the decision.
Yeah, Miss VE. Hey, Miss VE.
Hi, Miss VE.
She says her mother has had the shingles.
It's miserable to watch someone with it, right? And then you can get this complication. Even once the shingles goes away, there's something called post-herpetic neuralgia, where you just get these extreme pains even weeks, months, years after you've had the shingles. You can have it for life. There are certain treatments, certain antivirals, and the earlier that they're given, then the less likely you are to have those complications of things like the post-herpetic neuralgia. I'm sorry that happened to your mom. That's miserable. It's miserable. All right. So now we will move into our final section. And this is the 5-minute health checkup. Shador, if I'll have you put those slides up and tell me what's on the checkup, I'll give y'all the call to action. And then at the very end, oh my goodness, we'll still just take a couple of minutes to hear a few comments, and we'll prioritize our members and get a couple of Q&As in. But remember, if you want a full Q&A section where you can come up, ask questions, go back and forth, even come up on the video screen, then join the top tier of our membership. But that's not the only tier. We have other tiers where you can get our members only videos. Okay. And I have some of those up right now. And so if you join the membership, you'll have access to all of the months of members only videos that we've been doing. You also can get first look at some of the videos. Remember, click your notification buttons after you subscribe to this channel, because I have a new video that I'm releasing tomorrow, and I'm pretty excited about it. I think you'll find it very helpful. I want you to go ahead and share it with folks too, in honor of Kidney Disease Awareness Month. And then, of course, always, you go to my website, drfrita.com, and that's where you can find all things, my television appearances. Oh, I'm going to be on Good Day Atlanta again on this Saturday. That's at our local Fox 5 Atlanta station, and I'll be talking about health headlines with Dr. Frita on that show. I love being on that show. It's pretty exciting. All right, Shador, let's do our 5-minute checkup, and then we'll just talk to a couple people before we slide on out of this Medical Monday.
All right. Could your stress levels be a stroke risk?
Oh my goodness. There are some studies that are now showing that people with high stress, and largely women with high stress, are having increased risk for strokes. And we know logically that makes sense, because when you're really stressed out, that can cause high cortisol levels. High cortisol can lead to high blood pressure by causing your blood vessels to contract. And we know that high blood pressure is a leading cause of having strokes. And so if you're someone who's stressed out and people tell you need to calm down, have self-care days, breathe in, breathe out, take time for you, it's not just a matter of, pampering yourself or doing things that are foo-foo. It's a matter of life or death. So if you're a person who's stressed and you're stressed, find ways of self-care. Talk to a mental health care professional as well. And also right here on this Dr. Frita YouTube channel, I have some videos on ways to manage stress. And I go into more detail about how stress can affect your health.
All right. Secret weapon against cancer spread.
Okay. Now this one is interesting. There's been a study showing that we already know that people are starting to get cancer at younger and younger ages, right? And that's pretty frightening. There's this one study that shows that taking aspirin in some cases may decrease your risk for having cancer. Now, there's a caveat to this. So please don't just run and grab aspirin. Consult with your doctor, because aspirin has risks as well as benefits. There was a time, and when I was doing my training, where if you were over the age of 40, it was recommended that you take a low-dose aspirin every day, because we knew it could prevent heart attacks. It could prevent strokes. But then we also started showing where sometimes the risks outweigh the benefits, and having aspirin could increase your risk for bleeding ulcers, right? Stomach ulcers, peptic ulcer disease. It could increase your risk for having a brain bleed if you fall. Okay. So it's not an absolute for everyone, but this is some research that's being done. More research needs to be done. But before you run out and grab the over-the-counter aspirin, consult with your physician about the risks and benefits of aspirin. But yeah, some studies are showing that aspirin could possibly prevent some cancers.
All right. Thank you. The dark side of daylight saving time.
Oh my goodness, the dark side of daylight. This has been like in controversy forevermore. And we actually know that there's some places, some states where they don't do daylight savings times.
Mm-hmm.
So right now, it happened yesterday, didn't it? Where we had to spring forward, where we lost an hour. In the fall, everyone's happy. You fall back and you gain an hour. And we know that a lot of the pros of the daylight saving time is that you get more, daylight hours for your kids who are playing sports. If after work you want to go for a walk, it's not dark so early, and you can just kind of move around and maximize your daylight and your work hours. But also you can have some shifts that could be stressful as far as your body's own circadian rhythm. So there's pros, there's cons to it. But right now, if you live where we live, okay, then daylight saving time is just something that's a part. It's daylight saving time, not savings time. They say daylight saving time is just a part of your life. But yeah, if you ever, do your research and you feel strongly about it, you can certainly write your congressman, you can write your government, because this is one of those things that has been kind of a forever controversy. Daylight saving time, to do or not to do.
All right. Never too old to save a life.
Oh my goodness. Now this is the perfect story for Kidney Disease Awareness Month. Okay. And it's really interesting, Shadora, because we had a patient in our office just last week. We had a couple, and the husband was like, well, can I donate my kidney to my wife? And he's in his 70s. And I told him that they often do put restrictions on older patients, not necessarily just because of the age, but if you have diabetes, if you have high blood pressure that's on multiple medications, if your kidney function is not good, then oftentimes that will correlate with someone who's older, and they're typically not, chosen to donate kidneys. But definitely, regardless of your age, if you feel the need to get tested, because here we have a 73-year-old who was able to donate a kidney to a stranger. What a blessing, and save a life. Shador, let's roll that clip, please.
Oh, I don't have a link for that.
Clip for that one.
No,
all right. But that's just something. So it's Kidney Disease Awareness Month. So not only am I going to be putting a link up for the conversation I had with the National Kidney Foundation, I also was on the Portia show and a couple times last month, but we filmed a wonderful episode on organ transplantation and kidney donation. So stay tuned. I will be putting up, when that airs. And, a lot of times I put things here on YouTube, but my different social media channels have different things. So make sure you just check out at Dr.Frita, and also check me out on Instagram, because that's usually where I let you know when I'm going to be doing television appearances and when things are going to air. So go ahead, go to at Dr.Frita, give me a like, give me a follow, por favor. I post things on Facebook, LinkedIn, all those things. All right. Well, Shador, as we run out of here and wrap up, do we have a couple of little questions? We'll prioritize members, of course. Or do you have any comments as we slide on out? Thank you, everyone, for hanging in here with me. Thank you, all of you, for your support. I really, really, really appreciate you being here. And I do hope that you're getting something out of the information and getting something out of each other's comments, right? Because y'all have a lot of just really insightful, intellectual comments and input on things that you go through. And I know that I learned from you, and I hope that others learn from you as well. And for those of you in the replay crew, I appreciate you too. Make sure you give us a like, okay? And you share this video. All right. Any parting words, Shador, as we slide on out of here?
Yeah, I'm gonna ask a couple of questions, Dr. Frita. I know this one may be upon the minds of curious people about the MMR vaccine if you had it years ago. So the lion and the mouse posed a question: should you get a booster vaccine if we had it ages ago?
Very interesting. Okay, so if you had the MMR vaccine, if you had 2 doses, then it really has a 97% chance of giving you a lifetime immunity, right? Or at least up to 15 years. But here's the thing: if you had it years ago and you're really not sure, you don't necessarily have to run and get a booster, but you can, and I recommend that you do ask your doctor to test your blood to see if you still have antibodies to measles, mumps, rubella. Okay. There's a way that we can get blood tests to find out. And if your immunity has waned, then yes, it's recommended that you get a booster. For most people, they'll get a lifetime immunity unless you're immunocompromised. But yeah, the way to find out without just running and getting a booster is to get a blood test, ask your doctor a blood test to see if you're still immune to measles, mumps, rubella.
All right. Thank
Great
you,
question.
Frita.
That's a real good question.
And maybe perhaps a video recommendation or a short, Dr. Frita. T. Thomas asks, by chance, do you already have a video clarifying video on nephrohydrolysis?
On nephrohydrolysis?
Yes.
Spell that out.
Nephro. Kidney hydrolysis. So perhaps Thomas, maybe rhabdomyolysis, what we were speaking of earlier.
Oh, rhabdomyolysis. Go ahead. Double check that for me. And double check that spelling for me, please, and just put it right back up and we'll read it. Because nephro is kidney And then hydro water, lysis, the splitting of, if you're talking about rhabdomyolysis, then I don't actually think I have one on rhabdomyolysis, but you know what? That's certainly one that I could put up. For the other things I've talked about, I do have a YouTube video on measles, and I have shorts. You can look here on YouTube. I have a short on the measles where I was talking about, the importance of vaccines, what misinformation is doing. What else? I don't have one on hantavirus, but that's something I was thinking about as well. I do have a video here on the YouTube channel on dementia. We talked about Gene Hackman having dementia. I do have a short right here on the YouTube channel on bladder cancer with the late Dwayne Wiggins. What else did we talk about that I have a video on? Measles, shingles. Don't have shingles, but I do have one on the truth about vaccines. But see if that he pops that back up. I think he might have been talking about rhabdomyolysis.
All right. And I will leave us with a couple of comments here, Dr. Frita. This is from Kim. She says, you are wonderful, Dr. Frita. Been a subscriber for 2 years. This is my first live and enjoyed it.
Good. Listen, set a reminder. I want you to come back for the live. Of course, we always have the replays, but I love it when we have you live. I appreciate that, and I appreciate you for being a subscriber.
And she shouted me out, Shador. You are fabulous as well. Thank you.
Yes, listen, Shador keeps this thing going. Even when we have technical difficulties and I fall off a StreamYard, Shador has to keep this thing going. Oh my goodness. Yes, Shador, you are a lifesaver.
All right. And then last from our member, Dr. Frita, she says, become a member. You won't be sorry. So we'll head out with that one.
Yeah, please do. I'm telling y'all on these live Q&As, listen, let me just be honest with y'all. Yes, I've had my board certifications in nephrology, internal medicine, pediatrics, obesity medicine, but I promise you, not a day goes by where I'm not reading medical journals, reading medical information, researching. This is what I do because I love to do it. So when you join this membership at the highest tier, then every month you can just sit there and pick my brain. And I'm telling y'all, my brain is full and I love to share the information. And so even like when you have doctor's appointments or just some questions you're thinking about asking your doctor, or if you question some things, you have a chance to speak to an MD who's very well versed on a lot of topics. So I'm telling you, and I enjoy it. Y'all know I enjoy the live Q&As. And of course I enjoy this YouTube live. At any rate, I appreciate all of you, whether you become a member or not. I will keep giving you the evidence-based medicine. So yeah, so make sure if you're not subscribed to the channel, subscribe, hit the notification bell, check out my book, okay, Under Pressure, A Guide to Controlling High Blood Pressure. And if you want to have a one-on-one conversation with me, make sure that you click the link in the description for the telehealth concierge. We got all the things.
Yeah, nephrohydrosis. T. Thomas came back.
Okay. So the nephrohydrosis, and you might also be talking about hydronephrosis, where you get a backup of fluid in your kidneys. Okay. So the hydro again with water. So if you get hydronephrosis, then it can occur if, say, you have a big prostate and that's causing a backup of urine. If you have some type of a scarring, like if you have a scarring or tightening in your urethra, that's the tube that goes from the bladder to the outside world. If you have a kidney stone that's gotten caught in your ureter, so the ureter is that tube that connects the kidney to the bladder. If both of them happen to be blocked, you can get a backup. And also if you have a tumor, like if you have a uterine tumor, if you have a huge fibroid that's causing a backup. But basically, if you have hydronephrosis, then it's a backup of urine in the kidneys, and it can cause kidney failure, okay? Because you're stretching out the kidneys with the backup of urine, and you're preventing the kidneys from being able to flow. And so it can lead to kidney failure. The good thing is that especially if it's caught early, then either a Foley catheter or urine catheter being placed, or even a bladder catheter, or sometimes nephrostomy tubes going straight to the kidneys, relieving that blockage or obstruction can help it to get better early on. And then of course, getting rid of the underlying problem. So what I just described is the hydronephrosis.
All right. Thank you, Dr. Frita.
All right. Well, thank y'all. Shador, thank you so much. I appreciate y'all for coming in. And hey, this is Medical Monday. Y'all made Medical Monday. Monday's your healthiest day of the week.